Formulation. This animation is on the topic of formulation. A formulation is the written version of a process we all do naturally as human beings. For example, whenever we observe someone acting in an unusual or distressing way, we automatically develop an idea or hypothesis why this might be happening. To do this, we tend to use the information that we have available to us, such as the person's appearance, emotions, details of their behaviour, the settings, and other people's actions and reactions. This quickly informed impression we've generated will determine what we do next, whether we try to help the person, or avoid, or perhaps protect ourselves. In many ways, we are like an on-the-spot detective, using the available clues to come up with a best guess. While formulations are always, to a degree, guesstimates, the more relevant information we have, the more likely we'll be correct about our hypotheses. Take the example of a new patient who has just arrived on the ward. His name is John. One evening, John shouted angrily at Mary when she walked into the communal room at dinner time. Because he'd just been admitted to the ward, we didn't know too much about him. But we knew he'd always been a bachelor, and his sister had described him as a man's man who preferred the company of men. So our initial hypothesis was that John felt a bit mithered by Mary, who was a super friendly and very expressive woman, a person who had a tendency to break out into spontaneous song, something that appeared to irritate some of her fellow patients. Clearly, the amount and type of information we obtain is going to be important. However, as we get more information, it can become difficult to work out what's going on because there is a higher amount of detail to consider. And also, the different bits of information are usually interacting. Hence, there comes a point when we will need to record the information in a written form due to the heightened complexity. And we call this written framework a formulation. There can be a problem, however, when using written types of formulation, because there may be a tendency to try to add too many things to the formulation. And then we run the risk of producing a kitchen sink formulation. Kitchen sink formulations are too large and unwieldy, swamping us with far too much detail. So the rule of thumb should be to only collect the vital and relevant information. And this information must perform the following two functions. 1, to help us understand what's going on for the person, because this will guide the primary task. 2, to give us guidance about what to do to tackle the situation. In clinical situations, we call this feature our care plan. In the area of dementia care, we are very grateful to Tom Kitwood for providing us with a guide about what information should be regarded as vital and relevant. Tom Kitwood's helpful framework. In the 1990s, Tom Kitwood fundamentally questioned the medical model of dementia, which he perceived gave little importance to the experience of people living with dementia. He claimed that the medical model tended to attribute all experiences of someone with dementia to medical changes in the brain and body. In contrast, Kitwood himself emphasised the unique experience of people living with dementia and the interplay between neurological impairment and psychosocial factors. He emphasised the importance of understanding the experience of someone with dementia as resulting from a complex interaction between 5 factors, namely neurological impairment, health, biography, personality, and social psychology. He expressed his view in the form of an equation. The following diagram, derived from the equation, is sometimes referred to as the enriched model of care. This diagram has had a major impact on clinical services we offer in the UK, with most of the frameworks we have subsequently produced being based on Kitwood's work. For example, let's look at the case of John again, now that we have collected more meaningful information about him and his situation. The use of ABC charts show that the shouting is rather unpredictable, although when it does happen, it mainly occurs during the evening meal. One of the staff think that the initial trigger was an occasion when Mary asked John for some food from his dinner plate during the first weeks of his arrival. John had responded aggressively, saying no very firmly, and since then he's been more protective of his food. To understand his reaction, we can use Kitwood's framework. John is 64 years of age and has Alzheimer's dementia, but owing to a fall, he also has some frontal lobe deficits, which makes him more prone to disinhibited acts of verbal aggression. The fall has left him with some left-sided weakness, and this health condition makes him fearful he'll be taken advantage of. Prior to coming on the ward, he was briefly on a working-age adult ward, where he was bullied by some of the younger patients. In terms of his personality, his sister described him as a proud and determined man. She felt his personality was affected greatly by being the youngest of 7 children, and therefore always had to stick up for himself and try his best to be heard and taken seriously amongst the crowd. Based on the above information, we now have a more sophisticated understanding about what might lie behind John's behaviour. The trigger was clearly Mary wanting some of his food, and his interpretation and reaction reflecting his desire not to be taken advantage of. The use of formulations across the UK. Formulations take time to complete and often require people to be trained in their use. There are 2 areas where they tend to be used. Firstly, to promote and maintain well-being. Kitwood's model is an example of this. When using his approach, we can sustain people's well-being, resulting in a markedly reduced likelihood the person living with dementia will engage in behaviours that challenge. There are also examples of formulation frameworks that have been designed specifically for the management of behaviours that challenge. These tend to incorporate extra features in their assessment and management phases. The best example of this in the UK is the Newcastle model. In a recent UK survey of clinicians' views of formulation, the 4 most frequently used frameworks for the management of behaviours that challenge were, in order of popularity, the Newcastle model, Kitwood's models, a generic biopsychosocial approach, and the CLEAR framework. Let's look at each of these models. We will look at the biopsychosocial model first, because this is a generic framework and many of the other models are examples of this approach. This approach suggests that when managing behaviours that challenge, we need to look at 3 areas of the person's life: biological features, such as the nature of the dementia, and physical health conditions, including pain; psychological features, such as people's emotions, thoughts, and perceptions; and thirdly, social features. These are to do with the environment, such as interactions with people and settings. In terms of Kitwood's models, we've already seen the enriched model, but he also produced a secondary model called the Flower of Needs. In this, he suggested people have needs that should ideally be met to maintain their well-being. Love is at the centre of the model, surrounded by the following 5 offshoots: comfort, attachment, inclusion, occupation, and identity. Hence, when someone is expressing stress and distress, Kitwood suggested that we should check whether these needs are being met in these 6 areas. The CLEAR model is very similar to Kitwood's enriched model of care, information being collected in 5 areas: cognitions, emotional and physical well-being, life story and personality, activity and environment, and relationships. It is an approach designed to manage behaviours that challenge, and, like the Flower of Needs model, it is a framework that identifies people's needs. And by trying to meet the needs, it keeps people in a positive state of well-being. However, because the major focus is on supporting and maintaining well-being, the management strategies derived tend to be preventative interventions. And so CLEAR is less well suited for dealing with extreme agitation once it has arisen. The Newcastle model, the most frequently used approach in the UK, uses Kitwood's enriched model of care as the basis for understanding the key background features. However, it also attempts to get more information about the specifics of the behaviours that are being enacted. For example, a detailed description of the actions is obtained, including details of the exact words or vocalization used by the person, as well as their emotional appearance during the performance of the behaviour. These extra features provide important extra clues to help with understanding what is going on for the person and developing a plan about how to tackle the situation. For example, using the extra information, we can return to the case of John to see how the additional information can help us. As you will see, with information from these extra details, we see that his vocalizations are providing clues to why he's getting so upset. He's saying, leave it, thief, get away from the plate, F off. And interestingly, he only tends to vocalize in this way when Mary is standing up and mobile. And on the nights he shouts, he seems to be paying close attention to her and tracking her every move. All of these clues helped us unravel the cause of John's anger. Indeed, through further detective work, we learnt that he only tended to shout like this on those evenings when there were cupcakes on the menu. And then the penny started to drop, because we knew very well that Mary loved cupcakes, and in the past she'd been seen to take a cupcake from someone else's plate. Further, we'd also remembered we'd previously found a cupcake stuffed into her trouser pocket. But it was only when we put all the extra clues together that we were able to recognise that Mary was probably taking other people's cakes at meal times on a regular basis. Indeed, when we looked into her bedside cabinet, we found 12 uneaten cupcakes, which she'd taken and stored in the back of her cupboard. So the full story now was that John's anger was triggered by Mary's attempt to steal her favourite food. We think she'd probably tried to steal from him, but he had responded with verbal aggression. And since this episode, he'd become very wary of her and became upset whenever she was prowling around, casing the joint for cakes. As noted in this example, the more details, the more sense could be made of John's unsettled behaviour. Hence, future interventions in this situation involve providing Mary with sufficient sugar-free cupcakes to reduce her need to get up and try to take other people's food. This formulation was highly important. Indeed, it prevented John receiving the label of being aggressive and potentially being prescribed antipsychotic medication. In conclusion, this animation has given a brief overview of the nature of formulations. It has provided a description of Kitwood's enriched model of care, which is the grandparent of the UK models. A description of the usefulness of formulations has been illustrated using a case study. Finally, the animation has highlighted that a good formulation will always be a balance between too little and excessive information, with the ideal framework always providing only what is vital and sufficient to guide our interventions. Thank you for listening.